Hello, my dear friends. Dr. Amit Lall once again this side. Scope of Conservative Dentistry and Endodontics is known to everybody as the specialist who can run the clinic beautifully, be it any part of the country and in any city which is tier 1, tier 2, tier 3 or maybe the rural area. Why? Because cons-endo specialists can easily differentiate between the pain coming from the tooth or periodontal apparatus or elsewhere. Plus, they also know how to manage that. But this does not make you, you can say, guaranteed success after cons-endo. If you are a specialist with no good skills, please don't join any random college for cons-endo just for the namesake degree. That is the message I always have been giving. But yes, this is also one fact that most of the colleges cons-endo is pretty decent. Why? Because the maximum OPD is of dental pain. We all know this fact. Every second person walking into a college or your clinic even or any dental setup is related to tooth or periodontal pain. So cons-endo is always going to shine when it comes to the settlement after MDS. Plus, there is a lot of scope of consultations because many BDS graduates who have opened up the clinic and many other allied MDS specialists who are running their practices are always dependent on somebody to take care of the RCT factor, root canal therapy. Very good, they need a very good person to manage that because RCT is a pain in tooth plus a pain in every part of the body if it is not settled. So there is a lot of scope, but yes, it involves a good learning curve. To differentiate between a regular cons-endo specialist and the one you want to become in future is you should expand your wings. Conservative endo has like every you can say MDS passing out in India is 99.99% by heart endodontists and 0.001% by heart conservative dentists. So you will also be end up doing this because the colleges will be pouring you with a lot of RCT cases, and end of the day you will be master in RCT, but you will be little compromised in the conservative if your training is not that way. But my dear, you always have extra learning platforms. When you are doing your PG, make sure you learn the conservative part as well. Enter into the world of aesthetics. Very sorry to say, the best of aesthetic people in India for last 20 years, none of them is a conservative endo PG pass out. Okay, none of them. That is very shocking. But if you can attach those wings to your degree, you will be ruling the world like anything. That is one aspect. Plus, when you start up your clinic after doing MDS, maybe say 6 months, 1 year, or 2 years, definitely end up into training of implants by then. Don't leave the prosto part unattended just because you know RCT. Imagine you have a dental pain, God forbid you should not have, but suppose you have a dental pain. You went to a specialist endodontist and he or she will do the best of RCT in that tooth, but he or she is incapable to give a beautiful crown, and that too in good occlusion. That is waste of talent, I would say. Okay, so if you are ending up becoming a good endodontist, become a good conservative dentist as well, because that's your degree demands. Secondly, learn the nuances of prosto, basic nuances. As such, perio part you will be covering a lot in your degree, but the prosto part will always become pain in the neck if you are not good at it. And to enhance your practice, always learn the implants either during the course of your PG, but that is going to be very difficult. Plus, after passing out, invest in the education of dental implants and you will be roaring like anything. I always say one thing which I don't know how many of you end up following, but yes, I know some of my students who are doing MDS and they are very happy with this thought. When you are doing PG in one college, in one branch, that is what you will be end up doing. Make friends in the other specialties also. As such, you are going to make it. But don't make friends only for party. Make friends to learn their branch as well. Give them your knowledge, take the knowledge from them. You will learn many things in those 3 years which you may not learn coming out of the college afterwards. So my dear, all those who are going to plan or are planning to take cons-endo without hesitation, without fear, if you have done the basic Reiki of which colleges are good, which guide is good, go ahead with the branch. It is always and always paying in the long run. Rather, it is always paying even just after passing out. You get absorbed very fast in the corporate chains. You get absorbed in big dental setups. You get absorbed as a consultant in many clinics who are dependent on RCTs. So never be afraid of that. But yes, don't end up just becoming a person who is capable of doing good RCT, incapable of doing further rehabilitation of the tooth. That is one take home message for you all. All the best, and you can say congratulations to all those who will end up becoming conservative and endodontist very soon. Thank you. Have a great day.